Planned Parenthood provides safe and reliable health care in 820 communities across the nation. According to their literature, 97% of their services are preventative, primary care which helps prevent unplanned pregnancies and reduce the spread of STDs. Some anti-abortion advocates, though, are saying that because Planned Parenthood is mostly in minority communities, that they're targeting black women, and that this is systemically to exterminate African Americans. Joining me is Desiree Cooper, who now works for Planned Parenthood, and Pastor Christopher Brooks, who is a featured speaker at the Right to Life of Michigan's Black History Month Speaker Series. Welcome to ABJ. I would like to start this by saying let's try to have a civil conversation about abortion, which we don't have very much in this country. Pastor Brooks, I want to start with you.
Sure.
I don't want to assume that you agree with the sentiments that say that Planned Parenthood is targeting African Americans, but I know that you are an African American who's pro-life because of the disproportionate number of abortions in the black community.
Well, let me just say, going back to your first comment about having a civil conversation, I think what makes that difficult is what's at stake.
Sure.
I think in any conversation, the greater the stakes, the more passionate the discussion becomes. And in our quest to be civil, we have to understand that really what people are most concerned about is our most precious commodity. And in the black community, that's life, the life of a child. As a minister, I am very much committed to the concept that all life is in the image of God. And when you talk about Planned Parenthood, I think that we have to be honest and say that those who are part of the origin of Planned Parenthood have racist backgrounds. I think that's been well documented with Margaret Singer. But I don't think that we can keep that narrow view now. Let's be honest. I think we have to focus on the economics. And the fact is that the abortion industry is a very strong economic force. And where they position themselves has more to do with green probably than black. So I don't think that there's a genocidal agenda, but I think because of where it's been positioned, it is a byproduct of where they're positioned that disproportionately black and Latino children are more in danger.
Right.
Well, it's interesting that when we talk about the economic model, because it's a pretty bizarre economic model for 97% of your services to be geared toward ending the 3% that's in controversy. Right. So if abortion is in fact our economic agenda for Planned Parenthood, it would be reversed.
Right.
We would be spending 97% of our energy making sure that people, or promoting abortion. I want to be real clear. We're not pro-abortion. We're pro-choice.
Right.
People are going to have abortions, as we've known from history, whether or not Planned Parenthood is here, whether or not it is legal. And so since it is a legal, medically safe, generally procedure, that it should be a medical option for some people. But Planned Parenthood is not promoting abortion. 97% of our services are about prevention. And you were talking about having a civil conversation.
Sure.
And Reverend Brooks and I mean, we sat here listening to the other segment, and we really were talking about, we have a problem in the black community.
Sure.
And the problem is unplanned pregnancies. The problem are people not taking responsibility for their own reproductive health.
Right.
And together, we can work on that without going to the language about genocide or black children being endangered.
And in your church, in your community, I mean, that's got to be the message that you're imparting, is that the way to avoid or to decrease abortions is to stop unplanned pregnancies.
Yeah, the best protection against pregnancy I know is abstinence.
Right.
And so we do promote abstinence, but I want to just kind of, if I could, correct a little bit of what Desiree said. As much as I respect the work that she does, I think that we have to understand that yes, 3% of what Planned Parenthood does is direct abortions, but there's another 36% that goes towards emergency contraceptive kits that have within them pills for abortions. So if you add that 36% in, now we're approaching 40% of what's going on could lead to the death of a child. And again, what we have to understand.
And you would not draw a distinction.
Well, wait a minute. There is one distinction.
If I could just make just this final point. Again, what we have to understand is that 36% of the women who are having abortions are African American. Another 20% are Latino. So 56% of the abortions that are taking place are Black and Latino. By the time this broadcast is over, 90 Black or Latino children would have been aborted. Now, when we think about the conditions of our community and the potential that those babies do have, we have to begin to ask ourselves serious questions. Is the issue just starting an abortion? No, we do have to go back to talking about abstinence.
And let me just jump in there, because emergency contraception is not an abortion. If a woman is already pregnant, if they take emergency contraception, it will not abort the fetus. It is contraception. So that is for after you've had unprotected sex and you are not pregnant. So we want to make sure it is different. It will not abort a woman who's already pregnant. But I do want to just say this. The numbers are horrifying. And we were talking about the number of women, and I can only speak in the Black community now, who think that abortion is family planning.
It's family planning, right.
That's appalling to Planned Parenthood as well as to the Black community. You know, an article just came out in the New York Times that 55% of Black women between the ages of 15 and 44 do not use contraception.
Don't use any sort of birth control, right.
And so we have to look. We can go to our faith community and talk to people. If you're in a loving, caring relationship, the best care you can do to that relationship and to the family that you're planning for is to have a child when you want the child. And the reason why so many women of color come to Planned Parenthood is because we serve people without, regardless of their ability to pay.
Well, see, that's the
And so
the other
access
side of
to information, access to birth control, access to Healthy Women Check, cancer screenings, all of these issues are what we're providing to the community as a whole, regardless of their ability to pay.
And I think I disagree with the thought that the primary reason why people are going to Planned Parenthood is because this is a healthy, warm environment. I think that most often the women who are going there are afraid. Oftentimes they don't know of other options. I think it's important for us to talk about and celebrate the rise of crisis pregnancy centers and how those have been on the rise that provide a great alternative. I also think that it's very important for us to talk about real life situations. As a pastor who loves and cares for the women in my church and community, most often when I hear about their stories entering into abortion clinics, it's not the story of just being neutrally encouraged. It is being directed more often than not to abortion.
Do you feel like it's,
Yes, I do.
We've
and
got
it
about,
is very economically driven.
We've got about 45 seconds left. I know it's way too short for this kind of topic. What's the bridge between your 2 points, though? I mean, it seems to me that preventative measures and stopping people from getting pregnant.
Our greatest wish is that women would not be calling us with an unplanned pregnancy. This is our greatest wish.
And that's also your greatest wish.
And that every Black child that is born in the United States is born to a family that has planned and wanted them. And that is our greatest wish.
And for me, ultimately, every child is born in the image of God. And we have to allow God to control life. And what a grace it is to know that God does give us the opportunity to have life. And that's our goal.
Well, again, I would love to have a much deeper conversation. We'll have you back for that. Thanks to my guests and thanks to you. We'll see you next time on American Black Journal.